Thank you so much, JamimaMam, for accepting a very honorable and humble person. Thank you, ma'am. Thank you so much.
Nothing like that.
ஒரு பிஸி ஷெட்யூல்ல எனக்கு வந்து வேல்யூபுல்லா டைம் கொடுத்து நான் கொஞ்சம் அரியப்புல இருந்துட்டேன். ஸோ வந்து கரெக்டாக கனெக்ட் பண்ணீங்க. தேங்க்யூ ஸோ மச் மேம். உங்களோட இந்த கம்ப்ளீட் எக்ஸ்பீரியன்ஸ் மேபி மோர் தென் டிகேட்ஸ் ஆஃப் எக்ஸ்பீரியன்ஸ் உங்ககிட்ட இருக்கும். ஸோ பட்டிங் வளர்ந்து வர ஆப்டோமெட்ரிஸ்ட்க்கு நீங்க சொல்லணும், இந்த விஷயம் கண்டிப்பா ஒரு ஆப்டோமெட்ரிக்கு தெரிஞ்சு இருக்கணும், ஒரு யங் ஆண்டர்பிரினருக்கு தெரிஞ்சிருக்கணும் அப்படின்னு நீங்க நினைக்கிற விஷயம் ஷேர் பண்ணுங்க.
Alright. So optometry profession it's something which is very close to our heart, my heart, your heart, and all we as optometrists. And this initiative that you are taking, it's a very good initiative because because many people, they finish the 4-year degree course, and then after that, mostly the optometry students end up in optical shops. Nothing against optical shops, but we are a professional people, and we are healthcare people, and we need to be doing more than what an optical shop experience order. Our potential is so much great. So this book, I'm sure, will be helpful for many young optometrists. Yeah, so very good initiative. Yeah. So
Thank you.
Your book is going to be in English or Tamil?
Actually, I'm planning for both, ma'am. என்னோட students, friends கிட்ட எல்லாம் நான் வந்து when I discuss, what they suggest is this kind of book is the first edition. So what you have to we discussed is we can plan for Tamil edition and also for English edition as of now. And I'm writing in a way that people, whatever they're sharing their experience, I'm writing in English and also in Tamil. So generally அந்த மொத்தமா கோர்வையா போக்குறதுக்கு தான் வந்து it takes some time for me. So that's the main agenda. So mainly I'm planning on both Tamil and English.
All right. Yeah. So first thing, I always what I tell my students is they should always have a plan, a goal. Mostly people, they join optometry, they either they come to know about optometry course through their friends or relatives, or someone in their family has an optical shop or something like that, and they come and join. Very few percentage only where they or on the other hand, some people, if they are not able to get into medicine or something like that, so they come into optometry. There is only very few people who are very focused. Okay, I want to become an optometrist. Abdina join population, it's very less. So whatever that be the reason, it's all right. Now that they've joined, now they should have a focus. But mostly on the 3-4 years mudikira varaikum, they are just studying. Only after the 4th year or near the end of the 4th year, they start thinking what they're going to do. So first day, if they have a focus, it will be more better. That is what I feel. And what I say is, whatever position you're going to take, wherever you're going to take up your job, okay, whether it's all right, even if your own father has an optical shop, even then, okay, you have to think of yourself as a eye care professional, and you should be able to be, you should be equipped, and you should be able to do an independent practice. So irrespective of whether you're going to join an optical shop, you're going to join a hospital, you're going to do your higher studies, you're going to go into research, if you have the focus that I am going to establish my own eye clinic, you will be able to learn more better. Am I right? So because, okay, if this patient comes to me, if they come with this complaints, I should do these tests, it could be this diagnosis, these investigations need to be done. So that flow will be there. So right from the beginning, when you study, that should be the focus. So then you will be more oriented, and you will be able to gain more knowledge also. And wherever you are, you will shine well. So that is the first thing. And next is, in case that you are not able to set up your own eye clinic, and you just get a job in an optical shop, it's all right. What you have to do is convert the optical shop into an eye clinic. That's all. So it's no problem if you don't have a binocular vision clinic, you don't have a contact lens clinic, you don't have a sports therapy clinic. The same room, that 3-meter room is enough for everything, as far as I know. So you just have to, convert the optical shop into an eye clinic. You take case history, start taking case history, start maintaining records. Previously, we had to have registers, and then there won't be place to keep registers. Now everything can be stored in the computer. So we can make a difference. So if we start taking case history, if we start doing a proper refraction, and then do the binocular vision assessment, not a big investment. Minimum, we can do NPA, NPC, just maybe flippers and prism bar. We can do a BV assessment. Everything else is there. So one by one, if they start doing, that's all.
Thank you, ma'am. Thank you so much. In general, you have given a very vast knowledge about, as a basic part of entrepreneurship, they must have their own private practice. In the private practice, no matter that, the people having a optical shop or people having only the grind, it's completely a different genre. But as an optometrist, we have to have a entire genre of binocular vision. At least we can start taking the histories. That is which a very valuable thing, ma'am. My second questions would be, in general, the entrepreneurship is very far in India. Now, as an young budding optometrist, those who completing bachelor's, those who completing master's, those who completing degree, what is the first thing they must learn if they're coming out from the college? What is the first thing they have to learn? Either they should go with work, or they should start their own, or how to start their career first.
Okay, right after their degree, it will be best for them to work in an eye hospital. That is what will be the best recommendation. So in the hospital, they will have a wide exposure. They will be able to learn all aspects, all the departments and various subspecialties, everything. So that will help them gain good knowledge and experience. And then maybe afterwards they can, even for higher studies, at least if they work for 1 year and then go, it does make a huge difference.
Thank you, ma'am. As a personal question, in general, boys இப்போ ஒர்க் பண்ணி நான் போறேன் அப்படின்னா, என்னோட வீட்டோட சுச்சுவேஷன் அப்படின்னு சொல்லிட்டு நான் நிறைய பேரை பார்க்குறேன். கார்பரேட் செக்டர்ல போய் ஜாயின் பண்றாங்க. ஒரு பேச்சுலர்ஸ் முடிக்கிறோம் அல்லது ஒரு டிகிரி முடிக்கிறோம் அப்படின்னா, எடுத்த உடனே போயிட்டு எனக்கு ஹையர் சேலரி கிடைக்குது, எனக்கு ஹையர் பேக்கேஜ், செகண்டரி ஜாபோட டென்ஷன் எனக்கு கம்மி, நிறைய பேஷன்ஸ் பார்க்க வேண்டாம்னு சொல்லி இந்த ஒரு கம்ஃபர்ட் ஜோன்லயே இருக்கிறாங்க. ஸோ இதை பத்தின உங்களோட கருத்து?
So learning can happen wherever, in whichever situation. So in case they have a need for, where they have to support the family financially, if it's difficult, then they can go in that. Otherwise, it will be best to be in the hospital. But in the event that they have to go into this sector, there again, there are opportunities for them to learn. So based on where the person's interest is, they can go into research, innovation, all those also can happen. And most of these optical companies, they have people who have opportunities to go and teach others about their products and things like that. So that also will be a learning process for them. Yeah.
Thank you, ma'am. As an budding optometrist, in your initial stage, like JamimaMam பேச்சுலர்ல அவங்க முடிச்சுட்டு வெளியே வரும்போது இருந்த அந்த மைண்ட் செட்டு இப்போ JamimaMamக்கு இருக்கு அப்படின்னா, இப்போ வெல் எக்ஸ்பீரியன்ஸ்டு JamimaMam அவங்களுக்கு என்ன அட்வைஸ் கொடுப்பாங்க? அண்ட் வாட் ஆர் த திங்ஸ் ஷி ஹேஸ் டு தெரிஞ்சுக்கணும்? பிகாஸ் நிறைய யங் பட்டிங் ஆண்டர்பிரனர்ஸ் ஃபீமேல்ஸ் நம்ம நிறைய பார்க்குறோம். இப்போ நிறைய பேர் ஆப்டோமெட்ரி முடிச்சுட்டு they were working. So அந்த மைண்ட் செட் இப்போ இருக்கிற பிள்ளைகளுக்கு நீங்க சொல்லக்கூடிய அட்வைஸ்? ஸோ பேச்சுலர் முடிச்சு வர்றவங்க
Okay, yeah. So I finished my Bachelor of Optometry at Elite School of Optometry, and I had the privilege of working there in Shankar Netralia for nearly 5 years. So the experience that I gained in that hospital is enormous, enormous. And after which I joined Dr. Agarwal's, and I've been here for more than 10 years. So when I was in Shankar Netralia, I was in the clinical side seeing patients and learned a lot. And after being in the clinical side, now when I come to the teaching, I will be a more confident person teaching the students because I have a strong practical exposure. Nowadays, many people are, as soon as they finish freshers, they want to come and join in the teaching. So it will be always best to have practical exposure and then teaching. And even if they take teaching, they should have side by side practical as well as teaching experience. That is the best because there's no substitute for practicals. Yeah.
Awesome, awesome, ma'am. In which, how do you face the failures, ma'am? And generally, definitely when we started practicing, or when we started learning, when we started educating, anything when we take, we'll face failures. ஸோ அதுல இருந்து எப்படி மீண்டு வந்து இன்னைக்கு ஒரு கிட்டத்தட்ட ஆல்மோஸ்ட் 10-15 years எக்ஸ்பீரியன்ஸ் நிக்கிறீங்க. ஸோ வளர்ந்து வரக்கூடிய பெண்கள் ஆப்டோமெட்ரிஸ்ட் நீங்க சொல்லக்கூடிய or any yellow optometrist?
Okay, so I wouldn't call it a failure, but as you said, as women, okay, so there is a phase in life, where we do not have as much freedom as men. So I did have to take a break in my job. So when I was working in Shankar Netralia, I had to take care of my children, so I had to stop work for some time. But அதுக்கப்புறமா again to start back, it was very difficult. And when they told me to resign also, when I had to resign, it was very difficult, very heartbreaking. And I'm sure that every woman will be going through that as well. So the message for that is, taking a break is not a setback. It is not a failure. We are investing in the lives of our children, which is also equally important. So, and we are not going to lose anything because this years of experience. So after a break, when I came back, I was able to do everything well. Of course, theory part, maybe I had to brush up a little because if it was immediately clinicals, I think I would have done it quite easily. But since I had to do the teaching, I had to brush up a little bit. But definitely the years of experience was there. So it is very easy. We are not going to lose out on anything. See, lifeless senior or promotion, all that will come, may not come. But our family, our children, that is also equally important. So when we take care of this and leave the rest to God, God will definitely help us to come up. So I resigned, then now I joined as a junior lecturer, and now I'm both a lecturer as well as I'm the internship program head for Pan India of Dr. Agarwal's. So a break did not affect. I'm still able to do well. So need not worry, need not panic, need not feel depressed. Definitely, if we have that fire in our heart and that passion, we will be able to do it however long time it takes to get back also. But get back.
So exactly, ma'am. The same question, when I asked the younger budding optometrists, everybody, the kids and the budding optometrists are planning the same thing. இல்ல சார், கண்டிப்பா நம்ம வந்து மேரேஜ் பண்ணிடுவாங்க, விட மாட்டாங்க, இந்த ஒரு தாட் இருக்கு. ஸோ கண்டிப்பா அந்த பெட்டர் ஹாஃப் உடைய அந்த மைண்ட் செட் எப்படி இருந்துச்சு, அதை எப்படி நம்ம வந்து சரி பண்ணி தாண்டி வந்து இன்னைக்கு ஒரு சக்சஸ்ஃபுல்லான ஒரு ஆப்டோமெட்ரிஸ்டா ஜேர்னி லெக்சரரா பேன் இண்டியா லெவல்ல பீன் ஹியர். ஸோ அதனோட சப்போர்ட் எந்த அளவுக்கு இருந்தது சார், எந்த அளவுக்கு நமக்கு சப்போர்ட் பண்ணாங்க?
Okay. Yeah, all my family people were very supportive. So that's why I'm able to again come back. So initially children were small, so it was a little difficult. But afterwards, yeah, definitely without family support, I couldn't do so much. Yeah, definitely.
Yes, உங்களோட இந்த ஒரு எக்ஸலண்டான ஜேர்னில the inspiration part is very important. So உங்களோட இன்ஸ்பிரேஷன் ரோல் மாடல் அந்த மாதிரியான விஷயம்.
Inspiration role models, I have many. So yeah, so right from when I was in SNESO, yeah, the KK, our principal, E. Vaitalingam sir, so, and Lakshmi Shinde ma'am, and so many people, yeah, so will be an inspiration, yeah, and Aditya sir, Rizwana. So I can just say a list of people's names.
Awesome, awesome. How do you envision a future business of optometry industry or optical industry?
Business wise, yes, optical industry will have more sub things, like for example, a lot of innovation is coming up. So not only the optical products and things like that, we are going there are a lot of instruments and those things which mostly we were only getting from abroad, but now budding optometrists are very have all the knowledge, and also we have a good research backup. So many more those kind of products also are going to come.
Thank you, ma'am. For an optometrist, what is the daily routine we should follow in our entrepreneurship practice?
So learning one new thing a day will be the best thing to follow. So whatever it is, we need to, participation in CMEs, or even if there's no CME, read some book, or at least, get some information. So that will be good. And keep up with our peers, and, learn from each other, and update on the latest from each other. All those are important.
How do you describe a normal day of an optometrist? ஒரு ஆப்டோமெட்ரிஸ்டா ஒரு பேஷண்ட்டை பார்த்து கம்ப்ளீட் பண்ணி முடிச்சதுக்கு அப்புறம் தன்னோட லைஃப்ல என்னெல்லாம் அவங்க சந்திச்சிருப்பாங்க? உங்களோட நீங்க 5 வருஷம் எஸ்எம் அண்ட் 10 இயர்ஸ் ஆஃப் அகர்வால், ஸோ உங்களோட அந்த ஆப்டோமெட்ரி ஜேர்னி அதை நீங்க எப்படி டிஸ்கிரைப் பண்ணுங்க?
So when I was on the clinical side, seeing patients and all that, it of course it is a hectic schedule, but always when a satisfied patient goes out of our room, that brings great joy. So that's something which is so satisfying. So it gives so much of joy. And now I'm in the teaching side again. When when you teach, and when you see how we are able to mentor the students, and how they are they come up well, and then we see them doing well, that is something which gives great joy.
Three advice to the entrepreneurship persons, those who wanted to start, and three advice from your experience, or the students who were completing from உங்களோட டீச்சிங்ல படிச்சுட்டு வந்து வெளியே வரவங்களுக்கு three advice from.
Okay, so one of my own students has her clinic in Ananagar. So she has a vision therapy clinic. So I would narrate what she told. So I had given her a topic to talk on special children and optometry, and she had prepared the seminar. And then I had taken her and a group of students to a place where the vision therapy is given for children. And she said later, after several years, when I met her, she said, you gave me that topic to, as a seminar, and then you helped us to go and visit the special children. And now I'm having a clinic. So as I told, the same point that I told previously, have a focus, and when you learn itself, you try to absorb how much ever possible, so that it will be good to start your own clinic. And next is investment is something big. That is where people have a problem. So dream big. Maybe you can work wherever you are, and then start small, and then don't think that I have to have all the equipments and only then I can start a clinic. Not required. Start small. Start with the basic trial box and retinoscope, and then start investing slowly. So that will be good. And always patient care is the best. So, and do the best for the patient. patients will automatically come.
Awesome, ma'am. If not optometry, Jamima ma'am, if not optometry, நீங்க எந்த பாதையில போயிருக்கீங்க?
I was planning on doing engineering also. So to tell the truth, I didn't know about optometry when I started. So just my dad's friend just told that there's a course like this, and I just applied and got it by God.
As a mentor, as a teacher, as a lecturer, professor, apart from this, what is the one thing you miss? எந்த ஒரு விஷயத்தை மிஸ் பண்றேன் அப்படின்னு நினைக்கிறீங்க?
Miss in the sense,
எந்த ஒரு விஷயத்தை நான் இந்த ஒரு விஷயம் எனக்கு கிடைச்சிருக்கா இன்னும் கிடைக்கல, அத ஒரு விஷயத்தை something which is still you wanted to, அந்த மாதிரி.
Okay, actually I'm satisfied with whatever I am and I will take life as it goes. Yeah.
So what is the one thing as a teacher, as a mentor, you feel more happy and more satisfied?
I think as I told you earlier, like when we teach and mentor students and then when they do well, you know, so that's the greatest joy. Yeah.
Lifeல நம்ம optometrist after 10 years எப்படி இருக்கும், அந்த அந்த ஒரு விஷனரி நீங்க எப்படி பாக்குறீங்க? இப்போ நிறைய பேர் வந்து ஆப்டோமெட்ரி இண்டஸ்ட்ரியை வந்து கார்பரேட் குள்ள கொண்டு வராங்க, நம்ம பார்க்க முடியுது. நிறைய நிறைய பெரிய பெரிய நிறுவனங்கள் தான் வந்து படிச்சு முடிச்ச உடனே கேம்பஸ்ல செலக்ட் பண்ணி கொண்டுட்டு போய் பிள்ளைகளை வந்து ஃபாலோயிங் இன்டு தி வொர்க் ப்ரொஃபைல். ஸோ அதை நீங்க எப்படி பாக்குறீங்க? கார்பரேட்டோட இந்த விஷயத்தை உங்களோட பார்வை.
So corporate side, actually, I'm not very sure how to answer this. So 10 years from now, as I told, each person's interest. So wherever they are, they can, do well. So corporately, I will not say that optometrist, that is naanga allied school la irukumbodhu, we should only be in the hospital. Corporate side e pokudadu. Corporate marketing அதெல்லாம் bad mari. We are optometrists, we should be only here. That was the mindset. But you can, you are still, an optometrist is needed there wherever, whichever area they go, the need is there. And yeah, of course, a lot of corporates are coming up, expanding, so they do need optometrists. And there will be more of research and more growth in that as well. Sales, business, marketing, everything could there. Yeah, so that is going to increase also.
Thank you, ma'am. My final question. Optometry industryல இன்னும் எந்த விஷயம் இருந்தா இன்னும் நம்ம வந்து grow ஆகலாம்? உங்களோட thoughts, இன்னும் எந்த விஷயங்களா இருக்கணும்? As you said, financial management is very lagging. So இந்த மாதிரி இன்னும் என்னென்ன விஷயங்கள் எல்லாம் நம்ம ஆட் பண்ணோம் அப்படின்னா for the budding entrepreneursக்கு ரொம்ப யூஸ்ஃபுல்லா இருக்கும்.
When we were in allied school, we had subjects like accountancy, psychology, communication, all that. So ஒரு தனியா ஒரு பிசினஸ் நம்ம ஆரம்பிக்கணும்னா அதுக்கு என்னெல்லாம் தேவையோ அதெல்லாம் சேர்த்து சம் காலேஜஸ் சம் சிலபஸ்ல அதெல்லாம் இருக்கு இன்னும் கூட. So that is good. I think syllabusலயே அதை இன்க்ளூட் பண்றது is good. And that is, they should be given the confidence. That's all. Confidence. That's all. People study well, they do well. They only lack this confidence that நானே தனியா வைக்க முடியுமா அப்படின்ற ஒரு fear that is only there. So that is one thing. And next is they should they should not be afraid of referring. If there's anything, நான் என்னோட பேஷண்ட் வந்து அங்க போயிட போறாங்களோன்னு நினைக்க கூடாது. Patient first. And if we do good service, patient will come back saying, I want to meet my optometrist. So that will be there.
So lot of input, ma'am. Thank you. So no fear. தைரியமா ரெஃபர் பண்ணணும். அதே மாதிரி ஃபினான்ஷியல் மேனேஜ்மெண்ட்டாக இருக்கட்டும், சைக்காலஜியாக இருக்கட்டும், கம்யூனிகேஷன்ஸாக இருக்கட்டும், இந்த விஷயங்கள் எல்லாத்தையும் நம்ம வந்து படிச்சு கற்றுக்கிட்டு பேஸ்ல இருந்தே வரும்போது குட் டிஃபரன்ஸ் அப்படின்னு சொல்லியிருக்கீங்க. தேங்க்யூ ஜமீமா மேம் ஃபார் த வண்டர்ஃபுல் டைமிங். சச் அ ப்ளஷர். நம்ம இந்த த ஜேர்னி ஆஃப் ஆப்டோமெட்ரி அண்ட் த ஆண்டர்பிரினர்ஷிப் புக்குடைய இந்த லான்ச் இந்த விஷயங்களுக்கு நீங்க ரொம்ப டைம் கொடுத்து நம்மளுக்கு ஸ்பெண்ட் பண்ணி பேசுனதுக்கு ரொம்ப நன்றி. நீங்க இன்னும் பட்டிங் ஆப்டோமெட்ரிஸ்ட்க்கு உங்களுடைய ஃபர்தரான நீங்க எந்த விஷயங்கள் சொல்லணும் அப்படின்னா நம்ம கான்டாக்ட் பண்ணலாம் மேம். மேலும் உங்களுடைய டைம் கொடுத்து வந்து ஆனர் பண்ணி ரெஸ்பெக்ட்ஃபுல்லா பேசுனது ரொம்ப ரொம்ப சந்தோஷம் மேம். தேங்க்யூ.
Thank you so much and all the best for your book. Looking forward to read it, and I'm sure it will be helpful for all the budding optoms. Yeah, and more, special clinic, and students should start their own clinic, special clinic, and more branches in optometry should come up. Thank you.
தேங்க்யூ மேம். இந்த ஸ்பெஷல் கிளினிக் பத்தி ஒரு சில வார்த்தைகள் சொல்லலாம். ஏன்னா இப்போ மேம் வந்து பிவி கிளினிக் உங்க ஸ்டூடெண்ட் ஒருத்தங்க ஆரம்பிச்சிருக்கதா சொன்னீங்க. இன்னும் என்னென்ன விதமான ஸ்பெஷாலிட்டி கிளினிக்ஸ்லாம் ஆப்டோமெட்ரினால பண்ண முடியும்? அபார்ட் ஃப்ரம் ஆப்டிக்கல் பிவி பண்ணலாம். அபார்ட் ஃப்ரம் வாட் எல்ஸ் வி கேன்?
Yeah, so low vision can be done. So when I joined in Dr. Agarwal's, I started the low vision clinic there. So again, low vision clinic also start with small, just a few hand magnifier, stand magnifier, and then slowly you can improve on that. So that also can be done. Then computer vision clinic, much needed nowadays. So basics of binocular vision is required for everything. If you know binocular vision, you can start a computer vision clinic. You can start a neuro rehabilitation clinic. You can start a sports vision clinic. So you can go on and on. So sports vision also is something which is emerging, and more can be done. So a lot of avenues are there.
Thank you, ma'am. Thank you so much. It's great honor. Thank you.
Thank you.